everyone, in this video we are going to study about a new homeopathic remedy. It is going to be an interactive session, so you guys are going to guess the remedy based on some clues which will be given below. Guess me if you can. Is the remedy telling? What do you observe in this picture? Which condition is this where there is yellowish discoloration of the conjunctiva, the skin and the tongue? It is icterus. Hope you have written the correct thing in the comment section. What is the system affected in this? Which system is this? This is a hepatobiliary system. Next, anatomically, which side of the body is this system located? Where is the liver? The hepatobiliary system is located in the right side of the body. So, with this, we know that this remedy. Now, any guesses which remedy is this? Which is acting on the right side of the body. It is given for the condition icterus and it predominantly acts upon the hepatobiliary system. Any guesses? You can put it in the comment section. That is Chelidonium majus. You can see the picture of Chelidonium majus here. Common name Celandin. The objectives of this session. At the end of this session, we will be able to describe the drug picture of Chelidonium majus, the characteristic symptoms of Chelidonium majus, the gastrointestinal symptoms, respiratory symptoms. Chelidonium majus, the common name is Celandin. The source is vegetable kingdom. The family is Papaveraceae. Prover Dr. Hahnemann in 1819 proved Chelidonium. The mathematic background is Sora, diathesis, tubercular and rheumatic. So, Chelidonium majus, the miasm is going to be Sora and the diathesis is tubercular and rheumatic. The thermal relationships, Chelidonium, thermally neither they are hot nor they are chilly, they are towards chilly. The parts used is the entire fresh plant including the roots. We use the entire fresh plant, even the roots. So, Chelidonium majus, it belongs to vegetable kingdom. It was proved by Hahnemann. Miasm is Sora. Thermally, they are more towards chilly. Diathesis, tubercular and rheumatic. Now, the doctrine of signature, the Chelidonium, we get a yellow juice from it and the urine of Chelidonium patient is also yellowish and the icterus condition also there is yellowish discoloration of the conjunctiva. Sphere of action of Chelidonium. The Chelidonium, it acts predominantly on the right side of the body. It acts on the liver and gallbladder, stomach, skin, mucous membrane, that is the mucous membrane, respiratory system and kidneys. The constitution of Chelidonium, they are thin people, light complexion, blonde, irritable, they affect both sexes. So, Chelidonium, it is both female and male, both are affected and the people, how are they? Thin, light complexion, they have blonde hair, irritable people. The ailments from is the change in weather. Chelidonium, since there are change in weathers, all the complaints will arise from the change in weather. The characteristic symptoms, first we are going to look into the characteristic mental symptoms and then the characteristic physical symptoms. Characteristic mental symptoms, the characteristic mental symptoms are, they are highly despondent, inclined to weep, aversion to mental exertion and conversation. So, these people doesn't like to socialize. They have an aversion to conversations. They do not like any sort of mental exertion. They are despondent, they are sad, they are inclined to weep. You can see the person is weeping. They are inclined to weep. Next, mental symptoms. They are irritable as we read in the previous slide. I can't believe I forget, which means they're having a great absence of mind. They forget everything. So, absence of mind is there in Chelidonium and they tend to forget. Absence of mind and forget everything. The mental symptoms summarization: they are despondent, inclined to weep, aversion to mental exertion and conversation, great absence of mind, they forget everything. Next, melancholic. Melancholic means they are highly sad. People, melancholic, sad, fear as if committed the unpardonable sins, fear of getting crazy. So the Chelidonium patient feels that he has committed so bad sins that they are unpardonable. People cannot forgive, or the God cannot forgive their sins. They are unpardonable, unforgiving sins. They fear of getting crazy. Chelidonium fears that he might go nuts. Anxiety allowing no rest. They are very anxious, so anxious that the anxiety does not allow them to rest, which means even if they sleep, they cannot get sleep because of anxiety. They cannot rest. Every time the anxiety is going to keep up the patient, keeps him uneasy day and night. So the person is uneasy throughout the day and even the night. So guys, summary of the mental symptoms again: they are despondent, inclined to weep, aversion to mental exertion and conversation, they are tend to forget, absent-mindedness, sad, fear that they have committed unpardonable sins, and they have anxiety. Dr. Kent says that the liver troubles will make the person sluggishness of mind and inability to think. First, the liver troubles, it acts upon the liver, right? The liver troubles are making the person so sluggish. He becomes lazy by mind. He's become exhausted, lazy, and then which is rendering him an inability to think. He cannot use his brain. The liver troubles are acting upon the entire body, and it is causing a sluggishness of the mind and inability to think. Dr. Kent also says that the liver troubles will cause vertigo with confusion of mind, the person vomits, and the faints, that is loss of consciousness. You can see here the liver troubles are also producing vertigo, confusion of mind, vomiting, and loss of consciousness. General physical symptom, characteristic physical symptoms. Now let us look into the physical symptoms. How does it act? It affects the right sided predominantly. There is a constant pain at the lower and inner angle of right scapula. So guys, the scapula in the lower, you can see the scapula, it will be a triangular shape. The edge near the apex, there will be a pain, constant pain in the lower and inner angle of the right scapula. You can see it acts on the right side. So right scapula, lower and inner angle, there is pain. And you already know it is thick yellow coated tongue with the imprint of teeth. You can see there is a thick yellow coated tongue in the Chelidonium. So Chelidonium, you have to remember, it acts on the right side. Scapula, where will the pain be? Lower and inner angle. And then teeth, there is imprint of teeth on the tongue, and it is thick yellow coated. All the troubles are aggravated after dinner. Wilted yellow skin, bilious complications during gestation. So guys, you can see even during the pregnancy, the woman is having bilious complications, liver troubles, and the skin is yellow and wilted. The complaints are aggravating after dinner, in the night. Sleeplessness without being able to sleep. So the person is the person is having a great sleepiness without being able to sleep. The person is highly sleepy, but he is unable to sleep. In Chelidonium, person is sleepy, but he is unable to sleep. He dreams of corpses and funerals. So he dreams of dead bodies and funerals. He is more towards chilly. Now you come to the urine. Profuse foaming yellow urine. We read in the doctrine of signature, yellow juice of the Chelidonium. So the urine is also going to be yellow. There is yellow urine which is profuse in quantity, that is more in quantity. It is going to be foaming. The urine looks like beer. You can see so much similarity. This is the urine and this is the beer. How is the beer? It is foaming, yellow and profuse. In the same way, here the urine is also going to be profuse. Here the quantity, I mean the beer is profuse. You have to think about the urine here. It is profuse in quantity, foaming and yellow. Next, you see the desires of Chelidonium. The Chelidonium desire for very hot drinks, almost boiling. You see those people, they drink hot boiling tea, coffee, everything. The desire for hot drinks, they will be hot boiling, almost boiling. It is going to be that hot. The desire for milk, the desire for sour food, that is pickle. Aversions, they have aversion for cheese and they have aversion for meat. So fatty food, cheese and meat, aversions. The particulars, desires for 4 things you have to remember: hot drinks, milk, hot milk. You can remember like hot drinks, milk, then sour food and pickle together. Next, aversion 2 things: cheese and meat. Particular symptoms on each system of the body. First, let us look into the gastrointestinal system. Mouth, there is dry mouth, bitter taste in the mouth. John Henry Clark says there is bitter salivation, bad odor from mouth. So guys, you have to imagine the mouth of the Chelidonium. It is going to be a dry mouth. There is a bitter taste in the mouth. Even the saliva is going to be bitter. There is a bad odor, that is a foul smelling coming from the mouth of the Chelidonium. You see the tongue is yellow, there is imprints of teeth, there is bad smell coming from their mouth, the mouth is dry, and the taste of the Chelidonium, the taste in his mouth is going to be bitter, and the saliva is also going to be bitter. The tongue is coated thick yellow with red edges showing the imprint of teeth. The toothache, tearing pain from right ear to right teeth. You can see there is a tearing pain from the right ear to the right teeth. It acts upon the right side, so from the ear to the teeth, that is on the right side, right ear to the teeth, there is pain. Mucus flies from mouth while coughing. When they cough, the mucus is going to fly from the mouth. Mouth symptoms, the tongue, the dryness, then you have to remember bad smell, toothache from the right ear to the right teeth, and mucus is going to fly when they cough. Now let us go to the stomach symptoms. There is frequent belchings, eructations, tasting like juniper berries. Nausea with the sensation of heat in the stomach with the desire for food. Nausea is ameliorated by milk. So guys, here you can see there is eructations, belching. The person is going to burp a lot, and the taste of the burp is going to be like berries, juniper berries, and there is nausea with the sensation of heat in the stomach. The person feels nauseating and there is heat in the stomach. The person has a desire for food. Usually when the person is nauseating or he feels like vomiting, they don't crave for food. But in the Chelidonium, the person, when he is nauseating, there is heat in the stomach and he is desiring for food. The nausea is ameliorated by milk. Now you can look into the stomach complaints. There is bilious vomiting, sensation of coldness in the stomach, cutting pain in stomach when yawning soon after eating. So there is bilious vomiting. The vomit is going to contain bile in it. Bilious vomiting. There is coldness in the stomach. You see, there was heat in the stomach when there was nausea. Here generally there is coldness in stomach, cutting pain in stomach when the person is yawning after eating. After eating, see the person, you can remember like this, the person had dinner. The complaints are going to aggravate after dinner, right? So the person after dinner, he is yawning and then going to bed night time after dinner. So when yawning, there is cutting pain in the stomach. The abdominal symptoms, there is a great distension of abdomen with gas. You can see the abdomen is distended here with the gas filled in it. There is a rumbling, that is the sound is heard in the intestines. There is rumbling in the abdomen. The pain across the umbilicus as if constricted by a string. You can see the navel umbilicus here as if it is constricted by a string. The pain is going to be like that. Abdomen, you have to remember distension, rumbling and sensation of constriction near the umbilicus. Liver complaints, there is a constant pain under the lower and inner angle of the right scapula. We already read that in the previous slide. There was a pain in the lower and the inner angle of the right scapula. Yellowish discoloration of the face, forehead, nose and cheeks, wilted skin of palms and head. Next, liver symptoms, nausea and vomiting with a bitter taste in the mouth. We already read this. There was nausea and vomiting with a bitter taste in the mouth. Yellow, large, flabby tongue with the imprint of teeth. Sluggish liver with a great fermentation and accumulation of gas in the abdomen. So there was fermentation and accumulation of gas in the abdomen. Gallstone colic, the pain under the right scapula with nausea and bilious vomiting. There is a sharp lancinating pain in the gallbladder region. It is aggravated by touch and motion and ameliorated by pressure. So guys, the lancinating pain is going to ameliorate when there is pressure applied, and it is aggravated in the motion and touch. So by touch it is aggravating, but when you apply the pressure, you press it, it is going to reduce. What is going to reduce? The lancinating pain in the gallbladder region. The stool in anus, diarrhea, involuntary bright yellowish slimy stool at night. You can see the diarrhea. The picture is not given here. The picture is for the constipation. Now you guys focus on diarrhea. How is the diarrhea? It is bright yellowish slimy stool. Bright, everything yellow guys, every single thing. You have to write yellowish because the bilious affection. The liver is being affected. The constipation, stool is hard, round like a ball, like sheep's dung. You can see the Chelidonium's stool. It is going to be like a round ball like that of a sheep's dung, burning and itching in the anus. The constipation is going to alternate with diarrhea. So there is alternating symptoms in Chelidonium. What are the two alternating symptoms here? The constipation is going to alternate with diarrhea. The diarrhea is going to be bright yellowish and slimy, and the constipation, the stool is going to be hard like a ball, like a sheep's dung. Now let us go into the respiratory system of Chelidonium. For pneumonia associated with liver affections, the location is, see, I'll repeat, pneumonia associated with liver affection. The respiratory condition is pneumonia. It is associated, it is in combination, it is together with the liver affection. Both together association we are studying. The location of the lung, which side is affected? Guys, always the right side. So right lung is affected. The lower lobe of the right lung is generally affected. Fan-like movement of alienacy in pneumonia. So what is the characteristic here? There is a fan-like movement of alienacy in pneumonia. We saw the location, which side is affected? Right lung. The lower lobe of the right lung is affected, along with that fan-like movement of alienacy. Now we go into the sensation of Chelidonium. There is constriction of chest, sensation of dust, which is not relieved by cough. So you can see the sensation in Chelidonium, respiratory complaints. There is constriction of the chest. As we saw in the abdomen, there was constriction around the navel. In the same way, near the umbilicus, in the same way, in the lung complaints, they are going to be respiratory complaints. There is going to be a constriction of the chest, and there is sensation of a dust. It is not relieved by cough. The person is coughing, yet the sensation of the dust is not relieved. Sensation as if larynx were pressed on esophagus, impeding the deglutition. So, he feels that the larynx was pressed on esophagus. He also feels that the larynx is being pressed on by esophagus, and it is pressing the esophagus and it is stopping the deglutition, which is nothing but swallowing. Here the person feels that the larynx is pressing his esophagus. First the larynx is pressing on the esophagus. So after pressing, what happens? There is difficulty in swallowing. It is impeding, it is stopping the deglutition. Difficulty in swallowing is what the person feels. There are two sensations. One, in the throat he feels there is dust which is not relieved by cough. Then down he feels the larynx is pressing his esophagus and is unable to swallow. For pneumonia associated with liver affections, continuation, the character of pain, the pain on inspiration, pain in the right side of chest and shoulder. Pain in the larynx and sacrum while coughing. So guys, the character of pain, the pain is felt on inspiration. When the person breathes in, there is pain. Where is the pain? Again on the right side of the chest and the shoulder. So you can see the right side of the chest and the shoulder is paining when the person is breathing in. Also, there is pain in the larynx and sacrum. You can see top the pain is in the larynx and below sacrum when the person is coughing. Pain behind sternum, especially at night. So you have to see here the pain is in the chest, the shoulder, larynx, sacrum, sternum. So in the larynx and the sacrum when the person is coughing. And behind the sternum also the pain is going to be, and it is especially at night. Dyspnea, very quick and sharp inspiration. There is dyspnea and the inspiration is going to be very quick and sharp. There is rattling with difficult expectoration. You can see the person, he is unable to expectorate. Small lumps of mucus flies from mouth while coughing. When the person is coughing, you can see the small lumps of the mucus are flying from the mouth. The cough is excited by tickling sensation of larynx. How is the cough excited? What is the cough? The causative character for cough here. There is tickling sensation of the larynx which is initiating the cough in the patient. The cough is going to be so severe that it brings tears to the eyes. The person is going to cough to such an extent that his eyes are going to be teary. Throbbing in lungs, aggravated by deep inspiration and cough, sneeze. So we saw there is during deep inspiration the things are aggravating here. There is throbbing in the lungs which is aggravated by deep inspiration, cough and sneeze. Let us look into the modalities of Chelidonium. The aggravation is, we saw the ailment is the change in weather. So the aggravation is also going to be the change in weather, 4 a.m. and 4 p.m. You know this particular specific time is given for Chelidonium. The Chelidonium complaints are going to aggravate at 4 a.m. and 4 p.m. You can see the clock, it is striking at 4. Is it AM or PM? Both 4 AM and PM it is going to aggravate. Sleeping on the right side. So it acts on the right side. So aggravation is also from sleeping on the right side. Amelioration is early morning, motion, touch. Early morning, motion and touch are the, sorry guys, these are also the aggravations. We read the complaints are aggravated by touch and motion, the liver complaints, and ameliorated by the sharp lancinating pain. You remember that gallbladder sharp lancinating pain we read, it is going to aggravate by motion and touch and ameliorate by pressure. So same thing, aggravation, motion and touch, and early morning. Now we come to the amelioration. Amelioration by drinking very hot water, almost boiling. So we read in the cravings, the desires, that is very hot water. Same, it is going to ameliorate the complaints by drinking very hot water which is almost boiling. Bending backwards, a new thing, bending backwards after eating hot food. Hope the aggravation and amelioration is clear. We'll summarize it again. Change in weather, 4 a.m., 4 p.m., sleeping on right side, morning, motion and touch. Amelioration is going to be hot drinks, backward bending after food. Amelioration, sleeping on the left side. When the complaints are aggravating on the right side, so ameliorate left side. See, it acts on the right side. So, complaints are going to aggravate when lying on the right side. The painful side is going to be the right. So, when the person lies on the right side, the complaints are going to aggravate. When he lies on the left side, Chelidonium, left side, amelioration. Sleeping on the abdomen also, there is going to be amelioration. Let us look into the clinical indications of Chelidonium: constipation, cough, cancers, hepatocellular cancer. So the hepatocellular, the liver, hepatocellular cancer, carcinoma of stomach, dyspepsia, gallstone, gonorrhea, hemoptysis, that is blood in sputum, jaundice, lacrimal fistula, pneumonia, rheumatism, whooping cough. So with this we come to an end. You guys have patiently listened so far, so you have done a good job. Hope everything is clear. The references of this video are from the lectures of Homeopathic Materia Medica by J.T. Kent and Dictionary of Practical Materia Medica by Clark, Homeopathic Materia Medica William Borick, and Materia Medica of Homeopathic Medicines by Sir Fartuck, and Clinical Materia Medica E.F. Harrington. Any questions, any queries, you can put it down in the comment section. I will try my best to solve them. Thank you. Hope you like the video. If you like my video, hit the like button and subscribe.